everyone, welcome back to my channel Bloom into Womanhood, where I talk about all things womanhood, adulting, and public health. Today I will be answering through a Q&A all things about public health. Hopefully I can get majority of your questions answered. And please give this a big like and comment, subscribe. Let me know if you have any more questions below if I don't answer everything you have. So without further ado, let's get started. So for our first question, we have, what is public health and what can you do with a master's in public health? So I like to explain public health by thinking about the community level and also thinking about population. So when we think about countries, when we think about counties, thinking about how people, individuals, and how their environment, how their behaviors, how things like smoking, like if they smoke, if they don't smoke, if they're around a hog farm or not a hog farm that it emits some gas or can lead to some chemicals being in like their things like water through flooding, how these all impact the health of a community, and also thinking about things like gun violence, or if your community is safe, or you feel like your community is safe or not. So is it safe for you to be outside and like walk your sidewalk? Is it safe for your kids to go outside and play? All of these things can affect your like obesity levels and childhood obesity, and thinking about things like food insecurity. So public health can cover a range of things. It is all encompassing. So there's things like biostatistics, so thinking about how we compute data to understand public health issues. Also there's things like epidemiology, like studying diseases like cancer, HIV, anything like malaria. So thinking about like cholera, things that looking at things over time. And I'm so sorry if you hear like a siren right now from but also thinking about how you can look into like environment and thinking about pollution, rainfall, how these all impact public health. I'm trying to think of some other things, like nutrition is also another thing. So going back to childhood obesity, going back to breastfeeding work, and like, does your community breastfeed? I know like with Black women, breastfeeding rates are typically lower than white women. So all of these things are public health. And what can you do with the master's in public health? I'd also like to say you can do pretty much anything. It all really depends on your concentration as well. So whether you're like concentrating in something like health behavior, health policy, maternal and child health, epidemiology, biostatistics, environmental science. There's so many things, nutrition. I don't know if I said that already, but thinking about all of that, you can do anything with those concentrations or anything with those studies. So a master's is really the gateway to really, I believe, getting yourself into the door in public health. I know a lot of people actually struggle with using, if they have a bachelor's in public health, usually the bachelor's it makes it a little bit more tougher to get in the field. Most people are looking to hire masters, seeking people with a master's degree. And so if you're looking to, break into the field, I highly recommend a master's. So yeah, you can do pretty much anything with a master's of public health. The next question I have is, why did you choose a career in public health? So I have a really long story, but to just keep it short, I was actually pre-dental from my freshman year up until my junior year. I really did not like the coursework I was doing. I did not enjoy biology, anatomy and physiology, organic chemistry. I did not enjoy any of that stuff. And I just decided, like, okay, what can I do that is still going to encompass, helping people get better, making the lives and well-being of an individual better. And something that can encompass things like oral health, because I still had an interest in dentistry. But I also took an internship in my senior year that was focusing on women's health, and I was actually working with a big organization that is public health focused, and my mentor for that program was also in public health, and that was where I really started to see how I could make things come full circle with my interests in women and in oral health and pregnancy. And so that is ultimately why I believe that public health was a great field for me. I had a great time with my mentor. I really learned a lot with the other scholars, and I really felt like this was a community and something I could really be a part of. And also, like, doing public health, you're focusing more on preventative strategies and policy work, things that could really make an impact on a big scale, whereas things like looking at practitioners such as like a physician, a dentist, a nurse, they all do necessary work, but with that, they're looking at helping someone who has already caught a disease or someone that's already in pain. And public health is doing the work that helps prevent the pain, helps prevent the disease from occurring in the population. And so that's ultimately why I chose to do public health, to make a big and massive impact on communities and people around the globe. And also, with that being said, public health can be domestic or not public, global. So that's really great where you can get those two dynamics if you're interested. So for the next question we have, what do you study and why did you choose your concentration? So I study maternal, child, and family health. I ultimately chose this concentration, like I mentioned previously, from like my internship I had did my senior year, where I really fell in love with the maternal and child health community, and something I've been really passionate about is communities of color, and thinking about things like breastfeeding rates in the Black community, thinking about how those are low and how the work we can do to ultimately improve breastfeeding and improve like the mother's health outcomes, and how the baby can also experience better health outcomes from breastfeeding work. Thinking about things like maternal mortality, infant death, premature birth, how all of those things disproportionately affect communities of color and especially Black women. So I really wanted to be able to be a change agent in my community right here, locally, and thinking about what work can I do domestically in the United States that could really help with bettering the lives of women around the country. And so that was ultimately why I chose maternal and child health. But I will say that I was torn between things like health equity, which would allow me to study more about communities of color, health policy as another concentration, which would be able to help me, make the policy level impacts that could trickle down into the hospital system, into communities. So I was torn where I could see that I could make the same impact, not only in maternal and child health, but also in health policy and also in health equity. And for some, you can also do things in health behavior that could potentially, impact those and impact these issues, and like help narrow the gap in health disparities due to systemic racism. So that is ultimately why I chose my concentration. So for our last question, we have, what is grad school like, and how is the transition from undergrad to grad, and do you recommend a gap year? So I'm gonna be completely honest and blunt, and this is all my experience, and I am only a first year MPH student. I'm only have done my first semester, so things can change over time, but as of right now and as of my first semester, grad school has been a lot like undergrad for me. I graduated in May of 2020 and I started grad school in August of 2020. So I did not take a break. I did not take a gap year. And honestly, the workload has been a lot similar to undergrad. Now, I will say not all of the people in my cohort and the people in my school would feel that way, who are also first year MPH students, because we all are in different concentrations. We're all taking different material. So we all have different, numbers of credit hours. So, and also it really depends on your undergraduate institution as well. So like if you felt like you had a very rigorous undergraduate career, or it might be very beneficial for you in your master's degree, because the workload you won't feel as drained and as affected by the intensity level. But that also is subjective, so everybody is going to feel something differently. You have to think about things like if you have kids, if you have another job, if you have been out of school for a while, if you worked for it first before going back. So all of these things are really going to impact your experience in grad school and whether or not you feel like it's been a bit of a transition. And would I recommend a gap year? So honestly, it really just depends. If you are not sure about what exactly you want to do, if you have, these feelings that you're interested in something, you might be interested in something else still, I say go ahead and take the gap year. A gap year is a wonderful time for you to really get to know yourself, and also you could make some money that could be used towards your graduate school education. So that would be great in helping you not to go in debt. But I also know with like the pandemic and everything, like it's very hard to even get a job at this point. So a lot of people are just going to grad school. I ultimately decided to go to grad school before the pandemic happened. I applied back in 2019 of like in December. So I had already made up my mind, but I mean, if you have the momentum, if you have the energy, if you feel like you go press through another 2 years of grad school, I say go ahead and go for it. If you are tired, maybe just rest. Just take that gap year and work full time, and that way it's a 9 to 5. You can come home, relax, and really just rest and get yourself together, because grad school is a marathon, and you need to make sure that you're in a good mental health state and make sure that you're completely on the right path for you, and that you're not just deviating, but you know what you want to do. Another comparison that I want to go back to with like undergrad and grad school is I would ultimately say that grad school feels a lot more like I wouldn't say babysitting, but like the professors are more, I feel, involved and more invested in students from just my experience from my undergraduate institution, since I did go to a very large undergraduate school with my classes like 200-300 people. So like I'm used to not being very close to my professors. But for grad school, my classes are still very big. There's still like 200 people, but with those professors, they seem to very much care about your mental health, especially during a pandemic, and they are willing to make changes when students are ultimately letting them know that they are struggling with this, that a lot is going on, with the election happening and with pandemics and with personal issues. Like, they are pretty flexible, and I really appreciate that about grad school in comparison to my undergraduate experience. So yeah, those are all the questions that I had. I tried to make this video very short, but if you all have any more questions, please leave them in a comment below, and I will try to respond to most of them if I can, if time allows. And yeah, if you are interested in public health, keep checking on this channel. I hope to do more videos in the future. If you have an interest in womanhood, adulting, please check this channel out as well. And I leave all of my contact information, the website, Facebook, Instagram, Twitter. Please go follow Bloomington Womanhood's pages. I'm really hoping to grow Bloomington Womanhood into something wonderful as a wellness space. So yeah, if you're interested in being a part of this wellness space, and if you're interested in public health, please keep checking us out. And I hope you all are staying well and are staying healthy, and keeping your mental health in the right space and seeking help if needed. So take care of yourselves, and I hope you all have a great rest of your day. Bye.